Our today lecture is about the differential diagnosis between gout and pseudogout. So, first of all, we should know about gout. What is gout? So, gout is a form of arthritis in which mostly the small joint of the phalanx are affected due to monosodium urate crystal deposition at these small joint soft tissues. So, which lead to the inflammation, pain, swelling, etc. These inflammatory symptoms. So gout is caused due to high uric acid level in the body, and which lead to the monosodium urate crystal formation and deposition at the small joints, mostly of interphalangeal joints of feet and hand, so which cause inflammation and pain and arthritis. So this is gout. And now in pseudogout, the form of the crystal is different from the gout. In gout, this monosodium urate crystal deposition occur at the small joint, while in pseudogout, the calcium pyrophosphate calcium deposition occur at the joint, which can lead to arthritis and inflammatory condition of the joint. In gout we have discussed that the monosodium urate crystal while in pseudogout calcium pyrophosphate crystal deposition occur. So this was all about the definitions of the gout and pseudogout. Now we are going to our today topic, which is differential diagnosis. That how can we make a differential diagnosis between gout and pseudogout? So the first of all, we have to focus on the joint in which there is inflammation. So in gout, in one side I have to write gout, and other I have to write pseudogout, and I have to discuss the differential diagnosis, basic differential diagnosis points between gout and pseudogout. So first of all, we have to focus over the joints in which there is inflammation. In gout, the inflammation mostly, as we have discussed, that mostly inflammatory joints are the small joints. So in gout, small joints are affected. Small joints mean that interphalangeal joints of the feet and hands, while in pseudogout, mostly large joints are affected, and mostly in these large joints is the knee joint, which is mostly affected in pseudogout. So this is the one basic points between the differentiation of gout and pseudogout. The another one point for differential diagnosis is the type of crystal that we have already discussed in the definition of gout and pseudogout, that which if we aspire a joint and check and observe its crystal. Then we have to make a differential diagnosis between gout and pseudogout on the basis of that crystal type. In gout, the crystal will be monosodium urate crystal, while in pseudogout the crystal will be calcium pyrophosphate. So when this is another one differentiation type point for the making differential diagnosis between gout and pseudogout. The third one is in gout there will be severe inflammatory condition in the affected joints, while in pseudogout there will be mild to moderate inflammation at the affected joint. So this is the third one point between the gout and pseudogout, that in gout there will be severe inflammatory condition at the affected joints, while in pseudogout there is mild to moderate inflammatory condition over the affected joint. So the fourth one basic point is in gout the deposition of the monosodium urate crystal will be at the soft tissues around the joint. So crystal deposition will be at soft tissues around the joints, while in pseudogout the crystal deposition, which is the calcium pyrophosphate crystal, in this condition the crystal deposition will be at cartilage, which is present at the affected joint. And we can also call it chondrocalcinosis. So in pseudogout the crystal deposition, if we observe the joint through any imaging, if we study the joint, the affected joint through any imaging study, we will find that in gout the crystal deposition will be at the soft tissues of the which are present around the affected joint, and we also call it tophi. This type of deposition in gout we known it as tophi, while in pseudogout the crystal of calcium pyrophosphate will deposit in the cartilaginous structure, so we can also call it chondrocalcinosis. Now fifth point is the age. In gout is present at the age of 40 or at the age of more than 40. while pseudogout is present at the age of elderly age. Present at elderly age. Pseudogout is present at elderly age. In diagnostic procedure, we have to take diagnostic steps which can be ESR level. We have to observe ESR level, and we also check the uric acid, serum uric acid level. These can be some diagnostic steps for the gout and pseudogout. And if we find the uric acid, high uric acid, serum uric acid level and high ESR level, then it can aim as the patient, and with the support of the subjective and objective examination, we can call it gout, and we have to start the treatment of the gout on the basis of that specific proper investigatory steps and differential diagnostic steps. That is, NSAIDs, we can prescribe NSAIDs, and anti-gout medication, which is allopurinol, and can be colchicine, So for the gout condition, we have to prescribe this treatment, and physiotherapy, we have to prescribe cold therapy for the patient, and PT treatment, we have to prescribe cold therapy, and we have to prescribe relaxation and aerobic exercises for the patient with the gout. While in pseudogout, now if we differentially diagnose a patient which has pseudogout, and the subjective objective examination and different lab investigatory steps support us, and we make a proper diagnosis, which we gain a result that the patient has a condition of pseudogout. So then we have to prescribe NSAIDs for the patient with pseudogout, and we have to aspire the joint aspiration. So this can be the treatment options for the patient with pseudogout condition, and PT. The treatment is same as that for the gout, which is the cold therapy and aerobic relaxation exercises. So this can be the physiotherapy treatment for the pseudogout. So this was all about the gout and pseudogout. That's enough for today's lecture. I hope that you will gain good informations about the gout and pseudogout from this lecture. Thank you so much.